Welcome to Where Science Meets Self-Care with Ida Finelli. With over 30 years in beauty and wellness and a background in medical science, Ida blends clinical knowledge with holistic care. Each week, she and her guests share insights to help you achieve healthier skin, balanced energy, and empowered self-care. Now, here's your host, Ida Finelli.
Most people turn to light therapy for cosmetic benefits, reducing wrinkles, boosting collagen, and achieving that youthful glow. While I fully support these incredible anti-aging effects, many are missing a more profound truth. If something is anti-aging, it accelerates cell regeneration. You can harness red light therapy's mechanism for powerful healing and injury recovery. Today, I want to share some firsthand experiences demonstrating the life-changing potential of red light therapy and near-infrared light therapy. A biker's unexpected crash. It was a smoky day in June 2023. Due to the strong winds, intense forest fires were in cities near our areas. My 65-year-old husband still felt the need to bike ride in these circumstances. He was riding fast and his eyes were irritated from the debris in the air. Before he knew it, he hit a guardrail. He utterly skinned his left leg shin and surrounding calf. Leg injuries take longer to heal because blood flow is furthest from the heart. An individual's age and health also impact how quickly they recover. Injuries or surgeries occurring in the daytime heal better than at night because our circadian rhythm allows skin cells to patch up surgical incisions more efficiently. He had this factor to his advantage as well. I didn't take any pictures because writing an article about it was not on my mind at the time. The size was at least 6 inches long and 5 inches wide, spreading into the calf area. He had a subdermal hematoma. The swelling and bruising were extreme. The front of his shin was as deep as the back calf, and his ankle was very swollen from the incident. The injury was so significant that he had trouble standing on his feet for over an hour. There is a misconception that when you injure yourself, a scar will form. However, if you treat the injury properly when it's in the active stage of healing, deformed tissue will not develop. The power of red light therapy. My red light near-infrared LED light was instrumental in its healing. I used it on him every day. Each day, the scab came off after removing the dressings. The open wound shrank and fresh, healthy skin formed. We use the red light treatments at night after a shower. The unit I have requires 10 minutes of use spaced 2 feet away. After 4 days, he went to urgent care and the doctor examined and x-rayed him. I was worried about an infection since it was such a large open wound. They found no broken bones and said it was not infected, even though it was constantly weeping. They gave him no antibiotics. They said it was healing well. They gave him sufficient supplies and told him to change the dressings. We continued with the red light treatments, and after a while he began to do the treatments himself because he was delighted with their ease and effectiveness. His skin was very irritated. He used a lotion I made of various healthy oils, butters, aloe vera, and essential oils on the healed areas. Therapeutic red light includes wavelengths between 630 nanometers and 670 nanometers. Therapeutic near-infrared light includes wavelengths between 700 and 900 nanometers. It works by stimulating fibroblasts, the building blocks of collagen, which promote tissue repair and increase circulation. Collagen, a crucial protein in connective tissue, provides skin with structure and strength. Red light therapy also prevents the formation of misaligned collagen fibers, which typically lead to scarring. Therapeutic near-infrared light penetrates deeper into tissues and enhances healing by reducing inflammation, improving circulation, and accelerating cellular repair. Many people do not understand that red light, which is visible light, does not contain UV rays. Ultraviolet light is on the opposite side of the light spectrum. It has wavelengths of 100 to 400 nanometers. Red light penetrates the skin and underlying tissues without causing any DNA damage, addressing stubborn swelling and slow healing. After 2 weeks, I started wrapping areas around the open wound castor oil packs to reduce stubborn swelling in the impact areas. The center of the injury directly over the shin would not develop a scab. The shin is hard to heal because the bone prevents sufficient blood flow. I applied castor oil, a lymphatic stimulant, on the swollen portion of the injury, which softened the rigidness and enhanced the development of a scab. After 17 days, he stopped dressing the bandages and could resume complete work. After 4 weeks, he began running again. It takes some time for the lymphatic system to reduce the swelling. Exercise in the body's natural healing processes will allow this to happen. The after picture shows him as having no typical scarring. It's a bit red because he stopped wearing bandages when the scab was small enough. And the sun discolored it. You can see a previous scab from years ago on the outer side of the leg before I knew about light therapy. Thankfully, I don't have a before picture. That was too grotesque to post. A few months later, he had one session with a massage therapist who treated and helped him with red light and ultrasound. The laser is much stronger than the LED. During the treatment, she helped him with some stiffness in his leg. I use the red light to help kitchen nicks and cuts. Bandages are sometimes not necessary. Red light therapy for skin conditions and circulation issues. Beyond injuries, I've personally benefited from red light therapy. I have low blood pressure, which causes me to have poor circulation and cold hands and feet. Not a good thing to have when you're an esthetician. For the past year, I have been having an intermittent problem with what my doctor diagnosed as eczema on my toes. I attribute it to my feet having poor circulation since they are far away from the heart, and this winter's frigid temperatures and the fact that I'm getting older. People's feet get ugly when they get older. I see that a lot in my business. I tried the corticosteroid cream my doctor suggested out of desperation. It didn't help me much. Then I decided to try light therapy. The red near-infrared light eliminated my issue and helped me keep my eczema at bay as long as I used it daily. I have a picture displayed of the before and after. Notice how the redness has disappeared. The eye-opening research on red light and vision. Recent studies suggest that red light therapy may support eye health by enhancing mitochondrial function in the retina. The retina contains more mitochondria than any other area in the body, making it highly responsive to specific wavelengths of red light, typically around 670 nanometers. Research has focused on the cones responsible for color vision rather than the rods, which assist in low light vision. A study published in the Journals of Gerontology 2020 found that a brief exposure to deep red light improved color vision in participants over 40 by increasing mitochondrial activity in the retina. Other research supports the potential for red light therapy to slow age-related decline to vision. However, it is essential to use a device with 600 nanometers designed explicitly for eye health. Not all red light sources are safe for the eyes, and improper exposure could be harmful. Look for products that have been clinically tested and verified for ocular safety. In July 2021, sand fleas attacked me, and the constant itching on my lower legs and arms prevented me from resting. The next day, the sand fleas bites had developed a red halo. I was worried about cellulitis. A couple of days later, there was swelling, and the skin became rough on the areas where they bit. It felt scorched. A week later, I went to the doctor. He prescribed an antibiotic for me. I returned a few days later to see the blood testing results, and he ensured that I had an allergic reaction and recommended that I take prednisone. Sand fleas have an enzyme in their saliva that causes an allergic reaction and promotes our body to produce histamine to combat it. Antihistamines are also options for sand flea bites. I avoid these types of things because of their side effects. The pain had decreased, so I never used prednisone. I'll explain more about prednisone later in this video. One function of the skin is to release toxins. That itchy feeling you're getting in the body is trying to eliminate toxins from the cells. So my symptoms subsided after a while because my body was doing its job. I did try some natural remedies, but unfortunately that didn't help. I received my red near infrared light approximately 10 days after the start of my allergic reaction. It helped eliminate the itchiness immediately after one use because it hastened the cells rebuilding themselves and reducing inflammation. I continue to use it to speed up the healing of the sand flea bites. I don't have any scars from the incident now because I exfoliated regularly and used the red light to speed up the healing. Full disclosure, I had an allergic reaction to an antibiotic years later, and the red light did not help it. And now we'll take time for a commercial. Welcome back. Hair growth or hair loss, how red light affects both. The design and intent of a device plays a crucial role in determining whether red light stimulates hair growth or reduces hair. This is why it's essential to understand how different technologies work. Hair reduction versus hair growth. Hair reduction, intense pulse light, which is what I do. Devices use red light to target hair follicles and reduce growth over time. This method is commonly used for long-term hair reduction and removal. Hair growth. Red light therapy, LLT, works differently. It stimulates blood circulation in the scalp and reawakens dormant hair follicles, promoting hair regrowth. Many FDA-approved laser caps and combs use this technology to combat thinning hair and hair loss. Understanding the differences between IPL and LLT can help you choose the right device based on your hair goals. If you want to reduce hair, IPL is the way to go. Red laser light therapy is your best bet if you're aiming to regrow hair. I'll share some recommended products in the descriptions below. Oral care with red light. Years ago, I had a bit of gingivitis in the upper right side of my gums. I thought about how red LED light helps rebuild skin and how NIR light is beneficial for muscle, tendons, and bones. With my mouth open, I tried to use a more considerable red light on my facial area. It didn't work very well. I needed to use something inside my mouth. I searched the internet and found that light therapy devices exist for dental care. I purchased and used the device every day for 2 to 3 weeks. It cured my gingivitis. My husband had the same problem. He waited 6 months before ordering his. It healed his gingivitis as well. Our gums are pink and healthy. Most people use these devices to whiten their teeth. I used it to help heal my gingivitis. I've also read that some dentists use red laser light to speed up teeth movement when necessary. It decreases the length of time braces are required. Professional oral devices exist to help with teeth whitening and cavity prevention. Red light therapy for pets, healing and pain relief. Many veterinarians and pet owners use red light LED panels, low-level laser therapy, LLT, or near-infrared NIR light. This non-invasive treatment can help speed up or support the healing and reduce inflammation and improve overall wellness in dogs, cats, and horses, and even smaller animals. Wound healing and injury recovery. It stimulates cell regeneration, helping cuts, bruises, and post-surgical wounds heal faster. Joint pain and arthritis relief. Reduces inflammation and improves mobility in pets with arthritis, hip dysplasia, or joint discomfort. Muscle recovery, circulation. Increases blood flow, promoting faster muscle healing after exercise or injury. Skin conditions, infections, and allergies. It helps with hot spots, dermatitis, ear infections, or other skin irritations by reducing redness and promoting repair. Nerve and spinal issues assist in conditions like intervertebral disc disease, IVDD, in dogs by supporting nerve regeneration. I recommend using a device that fits your dog's size. Otherwise, it might not be his favorite thing to do. I also recommend following the manufacturer's instructions. Support cancer patients with red light therapy. I recently obtained a client who was undergoing chemotherapy for cancer. A friend had referred her because she was afraid to go to a busy salon with her condition. They had given her prednisone as part of her treatment. Prednisone, as we know, is a corticosteroid, which decreases the immune system. Yes, that's how they do it. By reducing the immune system, they decrease cancer's growth. Another side effect of corticosteroids is that they thin the skin and decrease inflammation. Her skin was bruising easily and healing slowly. Prednisone also replaces cortisol. The short-term uses of prednisone causes reversible skin atrophy. Long-term use results in stretch marks, which cause permanent damage to the skin. On top of that, her chemotherapy worked by blocking the cancer's growth factors. The human body makes many chemical growth factors that control cell growth. Cancer therapy slows down the growth of fast-growing cells. It damages fingernails, toenails, skin, and hair. During our session, I used a red light on her. The next time I saw her, she confirmed that the red light had helped her skin improve and that a naturopath had also told her that she could use red light. This led me to investigate the issue further, which opened up a new window of information for me to share with you. My knowledge of the chemistry of our bodies, interest in energy work, and experience with IPL made it easy for me to understand this concept. I hope you can too. The science behind red light's biofield influence. Our body's chemistry is made of mainly positive and negatively charged ions, constantly converting to different forms. For instance, a nerve impulse requires consistent movement of electrolytes in and out of the cell to take place properly. Quantum physics explains that interactions between elements generate an electromagnetic field around the human body. The nervous system and the mitochondria are mainly responsible for this electrical activity, creating an energy field responsible for cellular communication, regeneration, and overall health. Light is a form of electromagnetic energy. Photons are particles of light's wavelength. Lights act as a wave or a particle and travel in waves that interact with biological tissues at a quantum level. The medical profession is now looking at the physics side of things. This biofield, influenced by cellular electrical activity, is vital for overall health and healing. LED and low-level light therapy, LLLT, help restore balance to the body's natural energy fields, enhancing healing and immune response. I'll explain this concept further after we take time for a commercial. Welcome back. Quantum physics and the role of energy in healing. The human body operates at the quantum level, where electromagnetic fields, wavelengths, and energy frequencies dictate biological processes. The human body is fundamentally composed of energy, with biological functions occurring at the quantum level. Quantum physics suggests that all matter, including human cells, vibrate at specific frequencies, influencing communication between molecules, proteins, and enzymes. This understanding supports the idea that LED and LLLT influences these bioenergetic frequencies, promoting healing, cellular function, and immune responses. The human body is receptive to all light. Still, because it emits NIR light in its electromagnetic field, it's very receptive to invisible near-infrared light, which is a therapeutic light which can penetrate deep into the tissues, deeper than visible red light. Near-infrared and red light therapy work by interacting with this bioelectromagnetic field, restoring energy balance at a cellular level. The process of photobiomodulation, PBM, allows the power generators of your cells, called mitochondria, which are the most critical generators of cellular energy, to enhance the mitochondrial respiration when it soaks up red and near-infrared light, which allows it to increase the adenosine triphosphate, aka ATP, energy production from the mitochondria. This reduces oxidative stress and inflammation, promotes healing, optimizes energy production, reduces pain, and enhances the immune system's ability to combat abnormal cell growth and antibiotic resistance. Some medical communities members are switching from chemical-based treatments to physics-based treatments, including and/or switching to red light therapy for cancer patients. It improves wound healing from chemotherapy and radiation, which attacks normal cell growth to decrease cancerous growth. Surgical procedures and radiation therapy often lead to slow healing wounds. Cancer-related pain can result from inflammation, nerve damage, or tumor pressure. RLT releases nitric oxide, which expands the blood vessels, relieves and addresses pain, and stimulates endorphins. Fatigue is one of the most debilitating symptoms cancer patients experience. RLT helps increase energy levels and reduce exhaustion and muscle weakness by boosting mitochondrial function and ATP production. Sleep disturbances are common in cancer patients due to pain, anxiety, and medication side effects. RLT improves circadian rhythm regulation, reduces stress, and promotes relaxation. Lymphedema is when lymphatic vessels are damaged and a particular area becomes swollen or develops edema. Red light therapy stimulates lymphangiogenesis, the process of forming new lymphatic vessels, which is crucial for fluid balance and immune function. RLT increases lymphatic flow, reducing swelling and fluid accumulation in cancer patients experiencing lymphedema, especially breast cancer patients. And here's how light manages the side effects of traditional cancer treatments for oral mucositis. Red light therapy treats oral mucositis, a painful inflammatory condition that causes severe mouth sores in patients undergoing radiation and chemotherapy. Studies have shown that LLLT speedily reduces pain and inflammation in mucosal tissues, enhancing tissue repair and making it easier for patients to eat, drink, and speak comfortably. The American Society of Clinical Oncology, ASCO, has recognized LLLT as a standard supportive care treatment for oral mucositis in cancer patients, enhancing skin health and wound healing. Beyond cancer treatments, red and near-infrared light therapy are widely used for skin and health regeneration, which is particularly beneficial for cancer patients recovering from surgery, radiation, or photodynamic therapy. PDT, cancer patients with acne scars, eczema, and psoriasis, their conditions worsen after cancer treatments, and red light therapy improves these conditions. LLLT helps minimize sun-induced skin damage and radiation burns. Patients recovering from skin cancer surgeries experience faster wound healing and reduced scarring with LLLT. Red light therapy is safe for people with diabetes, allowing them to avoid amputations. Surgery incisions, wounds, and third-degree burn patients benefited from improved healing. Patients with previous scars found that their healed wounds became more tender with repeated use. These patients experienced much less pain and avoided the side effects of prescription medication and invasive procedures. Red light therapy, also known as low-level light laser therapy, is a safe, non-invasive treatment that combines specific wavelengths of red light and near-infrared light to stimulate cellular function, promote tissue repair, and modulate the immune system. Research suggests that LLLT may serve as a complementary therapy for skin cancer, improving treatments outcomes, alleviating side effects, and enhancing skin health. We'll explore this concept further after we take time for a commercial. Welcome back. Applications of photodynamic red light therapy, LLLT, in cancer care, a supportive treatment for chemotherapy and skin cancer. Near-infrared photoimmunotherapy is a promising experimental cancer treatment that uses an antibody photoabsorber conjugate to target cancer cells. When near-infrared light is applied, the skin cancer cells swell and burst, destroying them. Clinical trials are currently testing this for inoperable tumors. RLT enhances the effectiveness of photosensitizing agents that kill abnormal cancer cells upon light activation. This process limits damage to surrounding healthy tissues and minimizes scarring. Research suggests that red light may serve as a complementary therapy for melanoma by inhibiting tumor growth and enhancing anti-tumor immune activity. PBM does not damage tissues with heat because it is non-thermal, but instead modifies cellular activity, triggering apoptosis, programmed cell death, process in cancer cells while leaving healthy cells unaffected. Near-infrared photoimmunotherapy, which incorporates antibody photoabsorber drugs to reduce cancer cells, shows positive results in clinical trials for patients with inoperable tumors. The FDA has approved photodynamic therapy for various cancers when combined with light-sensitive drug photosensitizers with specific wavelengths of light to destroy cancer cells. The skin cancer it approves treatment for are actinic keratosis, basal cell skin cancer, squamous cell skin cancer stage 0. Photodynamic therapy also relieves symptoms of some cancers such as advanced cutaneous T-cell lymphoma, CTCL, which spreads beyond the skin and can cause painful ulcerated tumors and thickened skin plaque. Barrett's esophagus occurs when the lining of the esophagus heals abnormally and changes from skin cells to cells that look like intestinal cells. Esophageal cancer when it blocks the throat, and small cell lung cancer when it blocks the airways, when combined with a light-sensitive medicine. Photodynamic therapy generates oxygen radicals that kill tumor cells. It also damages tumor-associated blood vessels by cutting off their nutrient supply and activating the immune system to attack remaining cancer cells. It's also helpful for peripheral neuropathy caused by radiation. Red light therapy cannot penetrate deeply into large tumors, limiting its effectiveness for internal cancers. Some potential side effects include temporary redness, swelling, and irritation at the site. Photosensitizers used in photodynamic therapy can make skin and eyes sensitive to light for weeks after treatment, requiring precautions against sun exposure. Ongoing research and clinical trials explore the full potential of LLLT in oncology, paving the way for next-generation energy-based cancer treatments that work in harmony with the body's natural healing processes to improve cancer patients' life quality undergoing treatment. Final thoughts. A non-invasive energy-based approach to healing. While red light therapy is not a standalone treatment for skin cancer, scientific evidence supports its use to enhance the effectiveness of primary treatment by leveraging the principles of electromagnetic energy and quantum biology. LLT offers a non-toxic, non-invasive method to inhibit tumor growth and support immune function, reduce cancer-related inflammation and pain, support skin regeneration and wound healing. Red light therapy, also known as LED or low-level light therapy, is a non-invasive treatment that uses specific wavelengths of red and near-infrared light to stimulate cellular function, enhance tissue repair, and support the body's natural healing processes. Red light therapy offers a promising non-invasive approach to helping cancer patients undergoing chemotherapy, radiation, and surgical treatments. By promoting wound healing, reducing pain and inflammation, managing oral mucositis, and supporting immune function, RLT enhances overall well-being and quality of life. RLT integrates well with traditional chemotherapy, radiation, holistic cancer care, eye health, and general overall issues caused by poor circulation, as seen with diabetics. As advancement in research continues to produce positive results, RLT may play an increasingly significant role in the future of diabetic wound healing, cancer treatment, and supportive care. For full disclosure, here's the red light I used. It has a fan on it. It's very powerful. In hindsight, I'd like to share another story. I recommended red light therapy to a friend who severed some fingers with an electrical tool. They didn't use it until 6 or 7 months after the injury. They purchased a cheaper one that didn't cover as much surface area. They used it regularly and received pain relief benefits. A nurse who works with accident patients informed me the pain never goes away. They were using it to help reattach a finger bone. He had 3 operations and gave up using it. The bone didn't reattach. I only wonder if he had used a better quality device, if he would have reattached the bone. We'll never know. How to get started with red and near infrared light therapy. Choosing the right device is crucial if you're looking to integrate red and near infrared light therapy into your routine. Many people invest in light therapy just for their face, but that's a waste of money. Instead, opt for a versatile device that you can use across your entire body for maximum results. Choosing the right device when selecting a red near infrared light therapy device. Considering the following key factors. Some of these can be used for pets. Full body usability. Avoid limiting yourself to a face mask. A larger panel or handheld device offers better value and more comprehensive benefits. Heat and cooling features. Some red near infrared light devices generate significant heat and may require built-in fans. More heat often means greater intensity and better results, but it requires proper handling. For example, the Rubylux NIR light is an affordable bulb-shaped option that produces notable heat. Keep it at a distance since it doesn't have a fan to prevent overheating. Its red light option doesn't have that worry. It's only the near infrared light. This is the device I used for my teeth. And eye protection. Always wear protective goggles to block out light unless the device is specifically designed for eye treatments. Skin tone considerations. Not all skin tones can safely use red light therapy. Since red light penetrates the deepest of all colors, it may cause pigmentation issues. Hi, I just thought I'd like to give you some tips and tricks on how to incorporate red light into your day if time is an issue. You can utilize most of these things in combination with whatever else you're doing in the day. Like this is the one that I've had the longest, and it is the strongest because the company recommends that it be kept 2 feet away from me. It has 30 NIR bulbs and 30 red light bulbs, which I can use independently or together. And it does have a fan to keep it cool. So, I could place this under a table. And then this is another one that I have that is quite versatile. They give you a stand, and they also give you straps that you can harness in the slots at the bottom so you can actually tie it around different areas of your body. So the closer that you can put a red light to your body means that it's not as strong. That's why it has to be close to the body, right? And this one has an adjustable option with 7 different colors. And, you put it on bare skin. And all the lights you put on bare skin because they won't go through the cloth. And, this one is a nice one too because I've used this one just before I go to sleep. I just put it underneath the blankets. And, you don't need to wear the glasses, and especially if it's further away from the body, it's not an issue. And I find it helps me to relax because they say red light is good to use before you go to sleep because, it helps your circadian rhythm. And this is another one that I have. And both these two have timers. And sometimes what I do is I just keep this underneath the computer and I just slide the keyboard out, and I don't need to wear glasses. I can still do computer work at the same time when I have the light therapy on. And as I said, using a blanket to cover, I used a blanket to cover this up if I want to watch TV or something like that. And these are the glasses that I have. One company gave me these. I don't really know why they gave me these glasses because the light comes in on the outside. I don't really like these and I don't use them very much. And these are the Rubylux glasses. They say that these prevent all light, but they still allow you to view things when you're using them, which is So if you do want to watch TV or something like that when you're using them, you still can. And these ones block all the light, which are my most preferred ones. There you go. These are different ways you can incorporate them into your day. Check compatibility before purchasing. Staying updated on the latest technology. Light therapy technology is constantly evolving with new advancements improving effectiveness and safety. If a product truly benefits the skin, it should enhance the appearance and accelerate healing and overall wellness. Let's shift the conversation. Light therapy is more than skin deep. I hope you found this guide helpful. Thank you for viewing. Illumicell, a company based in Waterloo, Ontario, Canada, has demonstrated ex vivo that its LED red light therapy can deliver light energy much more profoundly than typical. These devices help with skin cancer. The company is currently seeking regulatory approval and financing to advance its mission. Light therapy in order of strength. LED, light emitting diode, LLLT, low-level laser therapy, IPL, intense pulse light, laser, light amplification by the stimulated emission of radiation.
Thank you for tuning in to Where Science Meets Self-Care with Ida Finelli. Ida bridges clinical science with holistic wisdom, guiding you toward radiant skin, balanced energy, and lasting well-being. Don't forget to subscribe, share the show, and join us next time for more inspiration and practical tools to help you live beautifully inside and out. To connect with Ida, visit linktree/Ida Finelli. Until then, take good care of yourself. And remember, self-care is where science and soul meet.